I was really drawn to family medicine for a number of reasons. For me, having continuity with my patients was really important to me.
All throughout medical school, I was just missing that continuity, and I felt like I would get to know patients and then I would leave and I would never see them again. What really interested me about family medicine was the relationships you get with your patients.
I wanted to see them more often, see if whatever advice or tips that I gave them, to see if it actually panned out. And then I also really liked the spectrum of family medicine. I like to see babies, I like kids, teenagers, adults. I like the whole gambit of family medicine.
To me, it's really special to build long-term relationships with our patients, and I think that's totally reflected in what we do here at Hunterdon Medical Center.
As we like to say, family medicine is real here in Hunterdon. It's been the center for healthcare delivery here in the county for over 70 years.
The Family Medicine Residency program was founded here really with the institution of the medical center itself. Hunterdon, when it started, knew that it wanted to be more than just a hospital, it wanted to be a teaching hospital. In 1969, when family medicine became a specialty, Hunterdon was one of the first residency programs in the nation to achieve accreditation for family medicine. Since then, we've been really part of the community of the Hunterdon Medical Center.
As residents at Hunterdon Medical Center, we have a very wide variety of responsibilities. A big part of that is being an unopposed family medicine residency program. An unopposed family medicine residency is one where the only residents in the hospital are family medicine residents. So you'll see us in every corner of the hospital, really doing everything in the hospital.
Things that are normal curriculum throughout the country were really founded here. We're working right now on developing our point of care ultrasound curriculum for our residents. And we also have a strong integrative medicine program as well as osteopathic training program to teach our residents. Early on, our directors believed in wellness and started a night float rotation for our residents, which really has been adopted nationwide.
When you are on nights, you're the resident covering the entire hospital. So really anything that's happening, you're involved in. When you're on OB, you're the OB resident. When you're in the ICU, you're the intensive resident. When you're in the emergency room, you're the emergency room resident. So we really get to do everything.
What's great about this process is the residents have the opportunity to collaborate with specialists and their expertise in the hospital.
Working alongside the attendings is awesome. They love teaching. Residents have been here for over 50 years, so all the attendings are here because they knew they wanted to teach and they're great at it.
The relationship with the attendings here is really open. Our residents are able to reach out to attendings and get the answers they need immediately.
They are highly invested in us learning and becoming great family physicians. They want to work with great family physicians in the future.
In fact, most of our residents go on to practice in the community. We want them to be excellent family physicians, as often they're going to be our colleagues within 3 short years.
Family medicine is really steeped in being a part of the community, and so the Hunterdon Family Medicine Residency has a number of programs that are important to us.
Community medicine rotation is actually where they have us go to different sites in the community and work with all the other programs that partake in patient care that may not necessarily be in the hospital or in the patient care setting.
It's an opportunity to really experience the challenges our patients may have in the community.
Being a part of each of our local community days. In Lambertville, we have the Shad Festival, where we're often a sponsor and very much a part of that. And then in Milford, we have Milford Alive. And the keynote of Milford Alive is a bed race, and we often compete at that bed race.
Over the last 5 or 7 years, we've either gotten the fastest bed, proud to say, or one of the funniest or most creative. So the residents participate in that and really enjoy it.
There are a lot of things that make Hunterdon Healthcare unique, but I think foremost among them is the people.
What I can tell you about the atmosphere at Hunterdon Medical Center is that it's a very kind, caring, and welcoming place to be.
Everyone seems so happy to come to work every day, which you really don't find everywhere.
One of our favorite things to do after a long day of working is we'll go up to the hill behind the hospital where we have resident apartments. It's really unique that we have those opportunities to socialize with each other outside of work, but with people from all areas of this hospital.
We're like a family, literally like a family in family medicine. It's a small community hospital, but everyone is supportive. Everyone works together to help each other and to help the patients.
Our residents feel that they've truly come home when they come to Hunterdon to train.